Hey everyone, welcome back to my channel. As we age, our bodies change. It's just a fact of life. We might not move as fast, we might not have the same energy, and we might start to notice a few new aches and pains. But while some changes are a normal part of aging, others can be a sign of something more serious. That's why it's so important to listen to your body and pay attention to any unusual symptoms, especially after the age of 70. Ignoring these signs could mean missing out on early diagnosis and treatment of potentially serious conditions. And trust me, as a doctor, I know that early detection is key when it comes to your health. So today we're going to talk about 7 often overlooked symptoms that you should never ignore after the age of 70. We'll cover what these symptoms could mean, why it's important to get them checked out, and what you can do to stay healthy as you age. So let's jump right in. We all feel a little tired now and then, right? Maybe you had a late night, maybe you're fighting off a cold, or maybe you just need an extra cup of coffee in the morning. But if you're constantly feeling exhausted, even after a good night's sleep, it's time to start paying attention. Look, I know it's easy to brush off fatigue as just a normal part of aging, but it could be a sign of something more serious going on beneath the surface. For example, fatigue is a common symptom of anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. And guess what? Anemia is more common in older adults. It can be caused by a number of things, like iron deficiency, vitamin B12 deficiency, or even chronic diseases. But that's not all. Fatigue can also be a sign of heart disease, thyroid problems, sleep apnea, depression, and even some types of cancer. So if you're feeling more tired than usual, don't just chalk it up to getting older. Talk to your doctor. They can run some simple tests to figure out what's going on and help you get your energy back. Because let's be honest, none of us want to spend our golden years feeling drained and exhausted, right? We want to have the energy to do the things we love, spend time with our loved ones, and live our lives to the fullest. Okay, so we all know that losing weight can be a good thing, especially if you've been trying to shed a few pounds. But if you're suddenly losing weight without any explanation, like you haven't changed your diet or exercise routine, then it's time to dig a little deeper. Sudden unexplained weight loss can be a sign of several health conditions, some of which can be serious. For example, it can be an early symptom of certain types of cancer, such as cancer of the pancreas, stomach, esophagus, or lung. Now, I know that's scary to hear, and I'm not trying to alarm anyone, but it's important to be aware of these possibilities. Sudden weight loss can also be a sign of hyperthyroidism, a condition where your thyroid gland produces too much thyroid hormone. This can rev up your metabolism and cause you to burn calories at a faster rate, leading to weight loss. Other potential causes include digestive issues like Crohn's disease or celiac disease, infections, and even certain medications. So if you notice that your clothes are fitting looser or that you're dropping pounds without even trying, don't just assume it's because of your age. It's crucial to talk to your doctor and get to the bottom of it. Early detection is key, and it can make a world of difference in the long run. Let's be real for a second. Nobody likes to talk about bathroom habits, but trust me, this is important. As we get older, it's normal for our digestive systems to slow down a bit, but any significant or persistent changes in your bowel habits should never be ignored. If you're experiencing constipation, diarrhea, blood in your stool, or a change in the color or consistency of your stool that lasts for more than a few days, it's essential to get it checked out. These changes could be a sign of a range of digestive issues, such as irritable bowel syndrome, diverticulitis, or even colorectal cancer. Now, I know that colorectal cancer is a scary thought, but it's important to remember that it's highly treatable when caught early. That's why regular screenings like colonoscopies are so important, especially after the age of 50. Your doctor can help you determine the right screening schedule for you based on your individual risk factors. So don't be shy about discussing any changes in your bowel habits with your doctor. It might feel a little awkward, but it could save your life. Remember, early detection is everything. Chapter 4, that nagging cough more than just a cold. We've all had a cough that just wouldn't quit, right? But while most coughs are caused by viruses and clear up on their own within a week or two, a persistent cough, especially one that lasts for more than 8 weeks, could be a sign of something more serious. Now, this is especially true for older adults who are more vulnerable to respiratory infections and lung diseases. A lingering cough could be a sign of bronchitis, pneumonia, asthma, or even chronic obstructive pulmonary disease, also known as COPD. And here's another thing to keep in mind. A persistent cough can also be a symptom of heart failure. That's right, you heard me correctly. When the heart isn't pumping efficiently, fluid can build up in the lungs, leading to a chronic cough, especially when lying down. Other symptoms of heart failure include shortness of breath, fatigue, and swelling in the legs and ankles. So if you have a cough that just won't go away, don't just try to tough it out. See your doctor to get it checked out. They can determine the underlying cause and recommend the best course of treatment. Waking up multiple times during the night to use the bathroom is not only frustrating, it can also be a sign of an underlying health issue. While it's normal to need to pee a few times during the day, frequent urination, especially at night, known as nocturia, can disrupt your sleep and affect your quality of life. One of the most common causes of frequent urination is a urinary tract infection, or UTI. UTIs occur when bacteria enter the urinary tract and cause an infection. Other symptoms of a UTI include pain or burning during urination, cloudy or foul-smelling urine, and pelvic pain. But frequent urination can also be a sign of other conditions, such as an enlarged prostate in men, diabetes, overactive bladder, or even certain medications like diuretics. If you're concerned about frequent urination, don't hesitate to talk to your doctor. They can help you determine the underlying cause and recommend the appropriate treatment. And remember, there's no shame in discussing these issues with your doctor. They've heard it all before, and they're there to help you feel your best. We all forget things from time to time, right? Maybe you misplaced your keys, forgot a name, or walked into a room and couldn't remember why. Those little senior moments are a normal part of aging, but if you're experiencing frequent or significant memory problems, it's essential to take it seriously. While age-related memory changes are usually mild and don't interfere with your daily life, more serious memory problems could be a sign of an underlying condition, such as mild cognitive impairment, or MCI, or even Alzheimer's disease. Now, I know that Alzheimer's is a scary thought, but it's important to remember that early diagnosis and treatment can make a significant difference in managing symptoms and slowing down the progression of the disease. So, what are some red flags to watch out for? Pay attention to things like forgetting recent events, having trouble following conversations, getting lost in familiar places, repeating questions or stories, or having difficulty with familiar tasks. If you're concerned about your memory, don't hesitate to talk to your doctor. They can assess your cognitive function, rule out other potential causes, and recommend the appropriate course of action. Our eyesight is precious, and as we age, it's common to experience some age-related changes in vision, like needing reading glasses or having trouble seeing in dim light. But any sudden or significant changes in vision should never be ignored. They could be a sign of a serious eye condition that requires prompt medical attention. For example, a sudden onset of blurry vision floaters, those little specks or strings that drift across your field of vision, or flashes of light could be a sign of a retinal tear or detachment, which is a medical emergency. Other serious eye conditions that can affect older adults include glaucoma, macular degeneration, cataracts, and diabetic retinopathy. These conditions can lead to permanent vision loss if left untreated, which is why early detection and treatment are crucial. So, if you notice any changes in your vision, don't wait to see if they go away on their own. Schedule an appointment with your eye doctor right away. They can perform a comprehensive eye exam, diagnose any problems, and recommend the appropriate treatment to protect your precious eyesight. Remember, your vision is a gift, so let's take care of it. So there you have it, 7 often overlooked symptoms after 70 that you should never ignore. Remember, your health is your most valuable asset, and it's never too late to start taking care of yourself. If you're experiencing any of the symptoms we discussed today, don't hesitate to reach out to your doctor. They can help you determine the underlying cause and create a personalized plan to get you back on track. Thanks for watching. And don't forget to like, share, and subscribe for more health tips and advice. Stay informed, stay healthy, and take care of yourselves. Until next time, remember, it's always better to be safe than sorry. If you or a loved one are experiencing any of these symptoms, don't hesitate to consult a healthcare professional. Stay informed, stay healthy, and take care of yourself. Thanks for watching, and don't forget to like, share and subscribe for more health tips.